Okay.
Hey Sam, are they watching that video we gave you? Oh, how do I do this?
Hey, Lila. Okay, let me get started. Welcome to today's live webinar, Cracking the Code, Mastering Radiographic Interpretations in Parrots, sponsored by VetaHead. We are so glad that you're here with us today. I also want to extend a warm welcome to our YouTube audience. I'm Sam, and I'll be your host and moderator. I'd like to go over a few housekeeping items with you before we begin. This session is being recorded and will be available later this week as an on-demand course on Vetfolio for a limited time. If you registered on Vetfolio and are attending the session live, no further action will be needed to obtain your CE credit. If you registered on YouTube, be sure to fill out the JOT form linked in the description. You will see your CE certificate in your Vetfolio learner profile within 24 hours. With that, I'd like to go ahead and introduce our speaker. I'm so happy to have Lila Parenza with us today. Dr. Parenza is the founder and CEO of VetaHead and PetaHead. She is moving the needle in veterinary space alongside VetaHead's teams, providing complete zoo med solutions to veterinary professionals. Their why is no species left behind, and Lila hopes to empower veterinary professionals through knowledge and make zoological medicine accessible by providing professional online courses at vetahead.vet. Now let's toss it over to our guest, Lila. Thank you for joining us.
Hello everyone, this is Dr. Proença. How you doing? I see a lot of known names in here. João Paulo, José Pedro. Oi, tudo bem, gente? Bom dia. Riley, Suzanne. So many people that I see so many times here, and also a lot of names that I had not seen before. So welcome. Thank you so much for being here today with me. It's 9 a.m. Where I am. I live in San Diego. Would love to know where you are in the world and what time it is for you. If you guys can put on the chat, I will love this. Thank you so much, Samantha. Thank you so much, Vetfolio, for this opportunity. I love being able to connect with everybody and be here and learn together. And today's topic is one that I have received a lot of requests on. It's interpreting parrot radiographs. That is something we don't learn at school, right? Either if you are a technician or a veterinarian, that is not something we learn at school. And of course, when we have our patients and we need to interpret, it becomes a little bit of a problem, huh? Look at all of you guys from all over the world. We have Marco from Argentina. We have Jessica from Colombia, but now live in Florida. We have Gabriela from Romania. We have Dr. Mohamed Driza from Iran. We have Mary from Boston, Anita from Czech Republic. Fun fact, that's where I got one of my tattoos. We have Jessica from California. Jessica is here on my time zone. Victoria from Scotland. Riley from Canada. Soup Ontario. This is amazing. Oh my God. So Hong Kong, 1 a.m. for one. Thank you so much for being here. Oh my goodness. Denise from Massachusetts, Felipe from Scotland, Gerardo from Venezuela, Arkansas, Suzanne, Mexico. We have Laura. Welcome, Laura. Portugal. Olá, Iracema. José Pedro. Eu sei que você está em Portugal, the romantic villa in Portugal. That's great. I'm going to be in Portugal next year. I'm going to be there for Eye Care, the international conference. Go there, guys. If you're there, it's going to be in Portugal. Turkey. Oh, my goodness. Okay. Canary Islands, Australia, India. Oh, my goodness. Philippines, Poland. And I keep, oh, my God, it keeps coming. Pakistan. Oh my God. Welcome. Well, this so many people. Samantha, do you see here the impact we have in the world? I love it. Thank you so much, everybody. You know, one thing that I would love, UK, Maria João, Portugal. Maria João, this could not be more of a Portuguese name ever. Love it. I love your name. Spain, Belgium, Iraq, Peru. Oh my God. Let's drink a pisco sour right now. Okay, I also want to know if you guys are a veterinarian or a tech, or when I say a tech, let's put there all the amazing people that help us so much and do their jobs. Without their jobs, this is not be possible. Either technician, a nurse, a vet assistant. And if you're a student, let me know here. Thank you so much. So without further ado, we're going to be talking today about radiographs in parrots, right? And I want to also, in this 30 minutes we're going to have together, I also want to talk about our agenda. We're going to go first talking about some tips, which we will include some tips too, and talk about sedation. Now, this is not the topic of our agenda today. I'm not gonna be able in 30 minutes to go deep on sedation and all the protocols and everything, but it is a vital portion of taking and then interpret radiographs, right? Because if we don't have a straight radiograph, we can interpret it. But you know what? Fear not, because as Samantha said, I am the CEO and founder of Vet Ahead. So if you use this QR code right now, take a picture, grab your phones, go to the QR code right now, because we teach everything about sedation, we teach everything about physical exam, restraint, we give protocols, everything you need at Vet Ahead. Okay, that's why it exists, so we can continue this education and you can be supported. And guess what? If you are a Vetfolio subscriber, this is a coupon for you, and you can get 20% discount of our yearly subscription. And then after we talked about these tips, and I'm also going to give some tips about equipment I like to use, the tapes I like to use, etc. Then we're going to talk about positioning, because that is very important. I would say, like, if the patient is not positioned well, we're not going to be able to interpret radiographs. And then the third point of our agenda is going to be talking about the coelomic organs. So I just want to make it our expectations all to be aligned. We're not going to be able in 30 minutes to talk about interpretation of everything on a parrot radiograph. We're not going to be able to cover musculoskeletal, etc., but we will cover the most important, which to this point right now that we're talking about, it's going to be the coelomic organs. So the systems, right? Respiratory systems, cardiovascular, digestive, reproductive. And then at the end, we're going to have a Q&A. So that's what we're going to have at the end for you guys. I see a lot of vets. I see a lot of techs. Ooh, students. That is brilliant. Brilliant. Emergency vet. Okay. Tahirani. Welcome here. We have a whole emergency course at Vet Ahead too. If you are interested, check it out. Okay, so let's start talking about sedation. I'm gonna show you this video first. Is a macaw. We're usually very scared of macaws, right? Because they can indeed cause a lot of damage to us, even like rip up a finger, right? And we usually so scared of them. And the reason I put this video right here is to show that sedation doesn't need to be scary. As a matter of fact, it's not scary at all. In this video, I'm demonstrating how to give intranasal sedation. And the reason and you're like, well, that doesn't help me, right? Because I still need to grab the macaw to give the intranasal. Well, you know what? You can give that syringe to the owner and you can say, hey, my friend owner, let's work together. You put this medication in the nose of your parrot, in this case, a macaw, and I will do my job later. And then what it looks like after we give the sedation is that a very restrainable macaw that is very drunk right there. And then you can go ahead and do your exam and even give more sedation if necessary. But it makes our job possible, right? And about sedation, I want to say two things here for you that are very, very important. Okay. A lot of people, understandably, again, we don't learn this at school. So we are afraid to sedate birds because we keep hearing this myth that sedating birds, that they are going to die. That is a myth. Okay. Of course, it needs to be done correctly. You need to use safe protocols. You need to monitor your patient. But sedation actually allows you to do everything safely because the parrot is not going to be stressed out, which it can cause them to die, right? The stress. So that's not going to be the case with your patient sedated. You're going to be able to position as the patient super well, and you're going to be able to take your radiographs. The second point is that you're not going to be exposing your team or yourself to radiation, and radiation is something that is very damaging, right? Marie Curie died when she discovered radiation, right? Because she was exposed to it. So in California, and it's going to be illegal to actually be exposed to radiation in a little bit. It's already illegal in some states in the United States, and we need to have hands-free radiographs. So I definitely want that for you. I'm going to show you a few videos right now. And I'm showing you how I use the option for the option on yes, I will teach my patient all the time. And as you can see right here on the left, that is a bear hugger without the pillow that is blowing warm air, and I keep that all the time, and that's an important factor because usually the x-ray room is a cold room, so I keep that blowing all the time. So the pillow is not going to interfere. The pillow that usually you connect to the bear hugger is not going to be there. It's not going to be interfering with my imaging, but the hot air is, right? And as you can see, I have my patient taped, and we're going to talk about that and providing oxygen and monitoring at all times. This is so important, guys, as important as acquiring straight radiographs, right? So we're going to be talking about positioning. And then to position our patient, X-rays, when we're talking about coelomic organs, we are talking about taking at least 3 views. Okay, we are taking a VD, which is ventrodorsal, and we're taking both laterals, left and right. Yes, we need to take both laterals just like we do for dogs and cats. Okay, so for positioning, we're going to start with the lateral view. As you can see on the right picture, this African gray parrot is sedated, right? That's why it's allowing me to do all of this. And I have both wings extended and taped together as to superimpose them. So the goal here is to only see one wing, basically, when we take the x-ray on the lateral view. And then you can see the legs are also extended caudally, and they are taped together to also be superimposed. So as you can see on the x-ray on the left, the patient is very straight, is not rotated, and we have the legs, the pelvic limbs, and the wings superimposed, right? Because on this, we are focusing on the organs with the coelomic organs. We're not focusing on musculoskeletal. If you are focusing musculoskeletal, it might be that you want to spread the wings or spread the pelvic limbs, right? But that's not the case for our radiographs right now. The other thing is that we're going to flip the patient later and also take right laterals, which we're going to attempt. We're going to do the same thing. You see there on the radiograph on the right how the wings are superimposed. We only see like one, as if it was just one humerus instead of two, right? The same thing with the femur there, and the pelvic limbs at a whole. And that's only possible because I have my patient sedated and calm. I will share something with you that happened with me that was the catalyst for me to actually start sedating all my patients. And I don't want this to happen to you. I had to fracture the wing of an Amazon parrot, and you heard me correctly, when I was taking VD radiographs. As you can see right here, it's not this case, but when I was in the beginning of my career, very scared of sedation. And I would have a acrylic. I had it manufactured an acrylic plate that had Velcro. You probably have seen that concoction, and that will Velcro the patient awake. And what happened was my patient was fighting that tape because it was awake, of course, was fighting the Velcro. And in the first shot, I see like that I took a VD. I saw a perfectly well-aligned bone. It was in the case was the ulna, and then when I take the laterals, the ulna was fractured. So I caused that because my patient was not sedated, and I don't want that for you. Okay, so here on the VD, it's a lot of tension, right? They're gonna try to flap the wings, and so we want those wings to be extended, to be parallel, and we want the pelvic limbs to be extended caudally, right, and be parallel. And we want the very important thing, if you look here on the left, which is our radiograph, we want the keel bone to be perfectly superimposed with the spine. So they're going to be just one. That way we can interpret the radiographs as we're going to learn. Okay, so in this video here, you can see that after sedation, this is how I actually position the patient. So you're going to see I have a first tape I put on the neck, and then I put on each pelvic limb. I put the tape again, and I will tell you exactly what tape that is. And then I extend the limbs separately. And the only reason I'm being able to do this again is because the patient is sedated. And then I make sure the legs are stretched or extended caudally and they are parallel, right? And then I'm going to do that with the wing. A tip here for you, we want to place that tape at the base of the wing. As you can see me on that video, I am putting that tape exactly at the base of the wing because that is the point of more tension. If you only put tape at the very tip of the wing, then you can cause a lot of tension. And if your patient is still struggling a little bit, you might cause damage to that wing. So again, always put your tape. You can put it at the tip of the wing too, as long as you put that on the base of the wing as well. And then I'm collimating right there. Always put in the marker, and that's a problem that we hate to see after the fact. Monitoring my patient, and you're gonna see in a few seconds I'm gonna walk out the room. There you go, because I'm not gonna expose myself to x-rays. I'm gonna close that door, hit the pedal, and take the rads, and then come back to the room and monitor my patient and continue my exam, right? But continue my x-rays. And then this is the tape that I use. This is not sponsored by the company that I use. Micropore is by 3M. This, I really love this tape. You can see right there. Is because that tape is strong enough to hold the patient, the bird, but does not remove the feathers when we remove the bird. Okay, like my experience using medical tape, we will remove some feathers when we remove the tape. Okay, so now that we talked about positioning, we talked about the tips, we talked about sedation, let's talk about interpretation. We're going to start with the VD. I'm going to look very quick here to see if we have any the tape, I will tell you, is the Micropore, okay? Micropore by 3M. You can I'm putting actually here on I wrote it down. The reason why we use the Micropore again is not to remove the feathers. This is a human tape, medical tape. And okay, guys, I see you. You can really Oh, got it. There's a question here about dyspneic patient. This is the whole no conversation, guys, because we're not talking about this right now. Like at VetaHead, you can look at everything. And I was saying on the video, I was just showing you guys how I tape the patient, how I secure every leg, and then every limb, every wing. And the very important thing that I was saying too is how I put the tape at the base of the wing. So if you look at this radiograph here, when I tape, I put the tape at the level of the humerus right here instead of just at the very tip. of the wing, because it's the tension, right? So if I only put a tape on the wing, if the patient tries to flap the wing, there will be a lot of tension and we can cause damage or even fracture the humerus. So that's where I put the tape right there. And I was telling you the type of tape I use to actually secure the bird in place. But that's basically what I was saying. The more important part of the video is to give you a visual or how I actually do it. So I trust that you were able to do it, to see that. And then I was also saying, very importantly, that we need to step out of the x-rays, right? When we actually take the x-rays, and having the patient sedated and using the tape and taping the bird, that allows me to step out of the room and take the x-rays, step on the pedal and take the x-rays, and not be exposed, either myself or my team, to the x-rays. Okay, so I'm going to move forward now with the interpretation. On the interpretation, again, we have here a very straight VD. We're going to start with the VD. As you can see, the keel bone is perfectly aligned with my spine, okay? So as if it looks just as one structure. And as we can see, the wings are at the same level and parallel, they extended, so are the pelvic limbs, right? So my patient is not twisted, it's not an oblique view, and it's very straight. That's gonna allow us to interpret the VD. If you don't have a perfect position, guys, we can't interpret. You're going to be left with more questions than answers. We're going to start here with the respiratory system. So in the respiratory system, everything that is marked as a light blue, we are talking about air sacs or trachea. We're talking about structures that are not the lungs. And on the darker blue, we can see the lungs, right? So why is that important? The trachea, when we are interpreting, we want to make sure that birds have a complete tracheal rings, right? So they don't have smooth muscle like we do in a C-shape trachea, like we do in mammals, for example, and it's some type of reptiles too will have that. But here we want to make sure that the trachea is air filled. We don't see any soft tissue opacities like granulomas, for example. And then we're going to evaluate the air sacs. We have the majority of parrots will have 9 air sacs, right? We can't see all of them 9 and identified on x-rays, but the ones that are very easy to identify are the clavicular air sacs that I have pointed there for you. Then we can see, of course, the lungs. And important here about the lungs is that on the VD, remember that the birds, they have very pronounced chest muscles, right? And on that chest muscle on the VD is going to be superimposed with our lungs. So our lungs are going to look a little busy, right, on the VD view. But nonetheless, you shouldn't see any soft tissue opacities there. You should be able to see that honeycomb appearance of the lung, which we're going to see way better on the lateral. Again, birds don't have alveoli, so we will be seeing that on the lateral better, because we're going to see the honeycomb appearance. Then we're going to have the thoracic air sacs. Actually, birds, they have two pairs of thoracic air sacs. They have the cranial and the caudal, but here on the VD, we kind of see them all together, right? Because if normal, the membrane of the air sacs is going to be so thin that you can't really see that division. So you're going to see as a thoracic air sac conjunction, but remember they have cranial and caudal. And then we're going to see lastly the abdominal air sacs. And here's the thing, sometimes when we have organs that are dilated, we won't be able to see all these air sacs. Then we're going to see the heart right there. We're going to see liver, and we're going to see proventriculus. And again, we can't really distinguish the liver from the proventriculus on the VD, but here I put to you to show where we would be. The proventriculus are going to be usually on the left, not usually, will be on the left side. And then we're going to have the ventriculus. So birds have 2 stomachs, the proventriculus, which is the true stomach that has all the gastric acids. And then we have the ventriculus, which is very thick, is the gizzard, right, where all the crunching happens. Right, so it would be like the teeth almost, right? Of course, there are no teeth in there, but it's where the grit that usually birds eat will help macerate the ingesta. And the ventriculus needs to be between the humeral head. So again, that's why it's very important for the bird to be straight. Then we're gonna have intestines right there, which we won't be able to tell if it's what part of the intestine, right? If it's small intestine versus colon, for example, or jejunum or ileum, we're not going to be able to distinguish them very well, but it's going to look kind of like a blob for us. But we want to be able to have serosal detail and identify the loops, even though we can't say which loop is which. And then we're going to have the cloaca. Right. So those are the organs we're going to see here on the VD. And another important aspect of the VD is that in parrots, we have what we call the hourglass silhouette that is formed by the heart, the liver, and the proventriculus. So this silhouette, first of all, in a parrot, you want to see the silhouette. You want to see the hourglass silhouette. If you're not seeing the hourglass silhouette, it means that either, let's say, there's no silhouette, it's kind of a straight line here, then it means that an organ might be enlarged, right? Either the liver, the proventriculus, or the heart. And also, if you trace imaginary lines coming from the head of the humerus to the head of the femur in both sides, you don't want these organs to pass those lines, okay? And then moving to our laterals, I want you to observe right now the lungs here, how you can see the honeycomb appearance that is a very typical of a bird lung. So when we're moving forward, let's go to the digestive tract first. We're going to have the esophagus right there, and then we're going to have the proventriculus. Remember that true stomach with the gastric acid, it in parrots is going to have a funnel-like appearance, as you can see right there. And then we're going to have the ventriculus that might or may not contain grit, which is going to be mineral opacity, right? That is not a foreign body. Usually they will eat that to help with digestion, but that's where you're going to see. And then we're going to have the intestinal area, as we talked about, in our cloaca, right? So all of that, you want to make sure you have serosal detail, even though you can't tell what that means. You can see some radiolucency in between the organs. You don't want that to be like a soft tissue appearance all over, like all white, which is ascites, right? Like liquid, fluid, effusion. Then we're going to have our heart right there laying on our sternum or the keel bone. And then we're going to have our liver. Why is it important to know where things are? And that's our goal today, is because let's say this proventriculus is now appearing, high up top here dorsally. So if the proventriculus is dorsal, well, you know what organ is right below it? It's the liver. It might be that our liver enlarged and pushing our proventriculus dorsally, right? Or let's say our ventriculus now is appearing cranial. Well, the proventriculus is supposed to be in the mid to caudal aspect of the coelom, so it might be that either our intestines, our cloaca, or even a mass is pushing it cranially. So all of those things that we are interpreting here, right? Then nonetheless, we have our kidneys. Our kidneys are going to be right below our synsacrum. So the synsacrum is that bone is fused in birds, and we want the kidney to be right ventral to it, okay? If the kidneys are enlarged, they're going to pass that cranial aspect of the synsacrum bone, and you don't want that. So the kidney in birds is elongated, has 3 lobes, cranial, medial, and caudal, and we want that beautiful kidney to be there. Then also, I want to show you the respiratory system here. We're going to have our trachea beautifully there. Then we're going to have our syrinx. The syrinx is the vocal cords in birds, is where they have the sound that is emitting there. So it's at the end of the trachea, right before it bifurcates to the bronchioles and the bronchioli, and going to the lung, the bronchi, and the bronchioli and the lung. And then we have the lung that we talked about already. We want to be able to see that beautiful honeycomb appearance. And then we have the abdominal air sac that we can visualize on the lateral. Again, we're not going to be able, and that might be a mix between the abdominal and the caudal thoracic. We're not able to really tell which one it is. And then last but not least, very important here, interpreting on the cardiovascular system. We saw where the heart was, right here. Now let's see the major blood vessels coming, the brachiocephalic trunk, the aorta, the pulmonary artery, the pulmonary vein, and right there, the caudal vena cava. You want to make sure they look good. They don't have mineral opacity, like to indicate arteriosclerosis in them. And then we can't see here, but the spleen will be located between the proventriculus and the ventriculus. A lot of times we can't see it unless it's enlarged, but that's the location. And on the x-ray we cannot see it, but not always we're going to be able to see the gonads, but it's going to be just cranial to the kidney, right? So that is our interpretation of the major organs, guys, of parrots. And I want to make sure that I address your questions before we move forward. Let me see here. If you're having a radiopacity in the thoracic air sacs, which is likely to be mostly aspergillosis, not necessarily, okay, depends how that radiopacity is. Yes, aspergillosis can cause the opacities, usually in a form of granuloma, but you have so many other things in the thoracic air sacs that can be there too. You can have actually bacterial, you can have cancer. There are some reports of cancer specifically too. There are some reports on the clavicular extending to the thoracic air sacs. You can have foreign bodies, right, in the thoracic air sacs. You can have fluid, so not necessarily. And to know the next approach, it's not the focus of our webinar today, but you know what? We talk about all of these that ahead, which leads me to our next point, guys. I want to be able to show you a little bit about vet ahead. The content part of this webinar has been covered, and I want to show you a little bit of vet ahead, because everything that you guys are asking me here, and that's precisely why I created vet ahead, because I will give webinars, I will go to conferences, and people had these follow-up questions that are natural, right? Because just seeing this interpretation, just learning about the interpretation does not give you the tools to actually perform medicine, right? To actually go to your routine, day routine. So I want to be able to show you, before I can move on, I want to show you a little bit of what you have in our subscription, which is mind-blowing. Please take a picture or a screenshot of this screen, or use your phone. You can join Vet Ahead using the QR code on the left. But hear me out. If you say, I'm not sure yet that I'm ready to commit, you can also go to the QR code on the right, and that is a free inside look inside of our subscription. You can download the app, you can look inside of the subscription. You're not going to be able to see the content, but you can see everything we have there and explore before you're ready to commit. And also remember here, Samantha just put it for us, a 20% off code. If you are a VetFolio subscriber, is using that code. So are you guys ready for me to show you? Samantha, you ready for me to show you guys how to look inside of Vet Ahead? Let me.
Yes. I just wanted to point out real quick that there are just a couple of other follow-up questions in the chat.
Oh, tell me, I missed them. Let
Yeah,
me see.
and there's also a question in the Q&A.
Oh, it's there. Let's see, because I looked at the message. Let me see the Q&A. I can't access that. There is a screen on top of it.
I can read it to you.
It allowed me now. On the Q&A, let me see there. Is intranasal intramuscular sedation better than using only isosavuflurane in a mask? As I said, we're not going to be covering sedation here today, but I will say this, Sarah: never mask a bird down. Okay, that is not appropriate. That's substandard medicine. We don't do that for dogs and cats, right? There's a reason for that. It's really risky, and that's why, birds will die under sedation. That's not what we use. But I talk in details, not only this question I answer, but in details. I give you sedation protocols, how to monitor, what's safe, how to reverse, all of that on the Vet Ahead subscription. Oh, I see, Jessica. Will pneumonia be more obvious on the lungs or on the air sacs too? That's a great question, Jessica. So pneumonia means that is in the lung. So pneumonia can only be in the lung. If you have lesions on the air sacs, let's say bacterial infection or even aspergillus, it doesn't matter. You have an air sac colitis, right? So when you say the term pneumonia, it means it's specifically on the lung, in the lung. Which sedative drug and in those, again, that's not the scope of our today. We were here to talk about interpretation of radiographs, but I knew this question was going to come, because I know, because you need all of those pieces, right, to be able to interpret radiographs. But at the Vet Ahead subscription, we have everything for you in details. May I ask, how is the setting of the X-ray for the size of the parrot, MAS, and KVP? That will, Shanice, and I hope I'm pronouncing your name correctly. That depends on your machine. Okay, so your machine, the manufacturer will come with instructions. So the majority of the machines nowadays, once you set the weight of the patient and the species, it will automatically set up the KVP and the MAS for you. It really changes from machine to machine, and also will change from the size of the bird. So it's going to be very different if you're doing, for example, a small parrot that weighs, I don't know, 30 to 40 grams, and then you're doing a macaw, for example, that can be like, 600 grams to a kilo. Riley asked, would you be able to tell if an SSEC had collapsed based on the radiographs? No, not necessarily, because remember, you seeing them overlapped, right? So let's say your thoracic, left thoracic air sac is collapsed, but the right is not. So you're not necessarily going to see that on the X-ray. So it can be a little bit more difficult. You might see it, that the surrounding tissue is extending on the VD, but you won't be able to really tell. CT will be the tool for that. Does Vera had Tahirani. Your name is so beautiful, and I hope I'm pronouncing it correctly. Does Verahead have any ultrasound C or resources for non-traditional species? Yes, we do talk about ultrasound in our courses. We provide resources, all of that good stuff. I know this is not the point, but would you sedate a dyspneic patient with intranasal midazolam? Okay, we will. This is like a very layered question. Is not just as simple as that. I can say that just like in cats, for example, when they are dyspneic, don't you give butorphanol for them to breathe better and be more calm? Well, that's the talking about sedation, right? Butorphanol won't do that for a bird, but I'm just saying, yes, I would. But again, it's so layered because it's it depends on what else we're looking at. But on the subscription, we talk about this. How to diagnose aspiration pneumonia on radiography? That's a very good question. So you cannot say for sure it's aspiration pneumonia, but you can say that it's very likely aspiration pneumonia with the location of it on the x-rays, right? Just like in dogs and cats too. So that's how you can tell. Now, sometimes aspiration pneumonia can, like what they aspirate, and I know pneumonia is talking about the lungs, but sometimes whatever they aspirate, if it's liquid, for example, it can make its way to the air sacs. Samantha, I know we are answering questions at the Johnson. Be mindful of the time of everybody. I'm happy to answer more questions. I just want to show a little bit about our Verahead substitution. I want people to see inside because there are a lot of questions about what we have in there. And then I'm happy to stay more and answer you more questions here. One more, Kelvin asks, can we see the cardiovascular on VD? Yes, I did show you guys there. The heart, the great vessels are going to be a little bit more tricky to look on the VD, right? Because there's so much superimposition there with the Q and the and also the that big muscle, the chest muscle. Okay. Let me just show you guys very quickly. I'm so excited to show you this. And I am happy, if that follow is happy, I'm happy to go back and answer more questions for you guys after I show you this. So let me show you a little bit of our subscription. Are you guys ready for this? Because it is amazing. Okay, so I'm gonna share my screen with you here. Okay, so this is how a subscription looks like. It has so much in it, and it has an app that you can download on your phone. It also has the desktop version, which is what I'm showing you right now. We have all of this on our subscription. Look at this. We have upcoming events that you can click here and see. We have Journal Club, Q&A, live case. Actually, you can come here and ask questions about your cases specifically. We have Journal Club, topic rounds. It's all here for you. You can watch all past events, all the recordings of every past event we ever had in the life of Verahead. You can come here and watch it. Okay. Then we also have our courses here that you can come and watch. And look at this, guys. We have calculators for you, which I'm going to show you our emergency calculator. That means you put the weight of the patient there and it calculates everything for you. And then you have the quick guides. Remember, someone asked me if we have sedation protocols. Well, we do. They are right here. If you click here, you get access to our sedation protocols, husbandry handouts for all the species that you can print and give to the owner, history forms if you need, to ask questions, anatomy reference. This is a beautiful handout with anatomical reference that you can see all of them. Those are all proprietary to Vet Ahead, but all the anatomy of all the animals there for you. How beautiful is that, guy? I hire medical illustrators to do this for us. And then we also have our journal clubs here, topic rounds, cases that I share with you guys that you can come here and, look at our cases that I shared that with you guys, what he did. Like this one has even a video and how I treated, what I done. It is so rich for you guys. Also, are you guys ready for this? Samantha, I don't know if you know, but we have a ChatGPT for Zoom ad that was trained by me in our subscription. It's called Coco. Coco is the name of my own African Great Parrot. So we name our AI agent after Coco. And you can come here and ask Coco any questions. For example, I can say, hello, Coco. Can I use, actually, a question you guys always ask me. Hello, Coco. What are the clinical signs of aspergillosis in parrots? Or you can ask something about your case. Coco is going to think, and Coco only researches on content that we train her on. She does not research online. She does not research on forums and like I love my rabbit.com. It's only on peer review, evidence-based cases. So all of these you can find. As you can see, I'm always talking to Coco here. For example, I ask, can you talk to me about otitis media in turtles and guinea pig, differentials and treatment? And it gives me the differentials, the clinical signs, diagnosis, how I treated. So you can do all of these with Coco. Coco is thinking right now, of course, because this is live, Coco is giving me a hard time, but I will come back to her later. On the emergency calculators, let's say you are sedating a bird, you're dyspneic bird, and you're sedating a bird, and you can come here to the Citacin emergency calculator, click on it, look, all zeros here, right on the medications. Once I punch the weight, let's say a 400-gram bird, boom, it calculates everything for you guys. All these medications, everything is calculated for you. You just need to print. So it's brilliant. And we were talking about sedation a lot, right? So I want to make sure this is our emergency course, for example. So this is where we talk about sedation and we talk about, and also you can come here and you can have subtitles, and you can choose the subtitles in 5 different languages. Subtitles in 5 different languages for you guys. You can, on the settings here, have it faster. You can come to the chapters here and say, hey, I want to be able to look at the sedation. For example, this is going to take you to the sedation in birds. This is going to talk about monitoring, so the videos go there. And of course, we have beautiful ebooks that look at this ebook where I'm gonna go quick. We have all the sedation protocols for you there. We talk about so much more in this ebook, all analgesia, everything there for you. So this is what we have on our, let me go back to you guys here. This is what we have on our subscription, and I'm happy to answer more questions for you. Let me look at the Q&A here. Let's see. Train local AI applications are wonderful. I agree. I use Coco every day. I really do. Mark says, oh, hello, Mark. How you going? Long time user of Vet Ahead, 100% recommend. I am a board certified and I use it. Yes, I am board certified and I use it. I love you. Thailandka. Oh my God, that's such a beautiful name. Thank you so much. Thank you. Oh, people were asking, Jenny says, the recording of the webinar will be available. Yes, it will be available on the Vetfolio and YouTube, okay? So you can definitely go there. Sam, where can they find the recording on the YouTube? Do they just go to the Vetfolio YouTube channel? How can they see it?
So it's on our NAVC YouTube channel.
Okay, NAVC. So do you have the link there that you can put for them here? So it's easy for them to see later. And it seems like we
Let
have
me see
questions
if
in
I can
the
get it.
Q&A. Dr. Amar asked, would you be able to identify ceratospictolon and X-ray in caudal-thoracic air sacs? So you might be able to see soft tissue opacity, but you can't tell, like X-rays, right? We can't tell what it is, right? You will see a soft tissue opacity, and then one of your differentials might be that one. So again, it will not tell you what it is, obviously. For that, you're gonna need to do additional testing. I think I answered all of the Q&A. Let me make sure I answer everybody on the chat. Let me see. I think I answered them all. I think I did. Anything I'm missing, Samantha? Guys, any questions that I have not answered? Can you repost it? Sometimes it gets lost on the thread there.
No, I think you got everything, actually.
Oh, Thailander says, please put up the link. João Paulo, thank you. Of course, you're welcome, my friend. Denise says, this was an excellent presentation. Thank you so much. Oh, Denise, thank you. I really, really do appreciate that. Guys, everything I made with VetaHead was made with so much love. I put so much into it. Also, follow us on social media. Is VetaHead.vet. We are on TikTok. We are on Instagram. We also on YouTube. And I'm really passionate about educating. I am from Brazil originally, a developing country, and I know how hard it is to get access to information in Zoomed or exotic animals, right? It's merely impossible. That's why I put all this content together for you. And Vetfolio has been a partner and helping spread Zoomed content. And I really appreciate them. Thank you so much, Samantha. Thank you, everybody that has been here.
Thank you, Lila. We appreciate you too. Thank you so much for this presentation. And I did see that you can find it on our YouTube channel under past events, but also on Vetfolio, it'll be available on demand.
Thank you.
Okay.
Thank you, everybody.
Thank you, Lila.
Bye-bye.
As a reminder, if you're registered on Vetfolio and are attending this session live, no further action is needed to obtain your CE credit. If you registered on YouTube, be sure to fill out the JOT form. You will see your CE certificate in your Vetfolio learner profile within 24 hours. This session will be available on demand through Vetfolio in the coming days. We want to thank all of you for joining us. Thank you so much to Dr. Lila Parenza for a fantastic presentation, and thank you to VetaHead for sponsoring today's webinar. Have a great day.